We start Tuskegee study presentation. Background and significance. According to Barrett, the Tuskegee study is the most extended non-therapeutic experimentation on human beings in healthcare history. Begun in 1932 by the United States Public Health Service in collaboration with Tuskegee University, a historically black college in Alabama. The purpose of the experiment was to find out how the disease affected the patient if syphilis was left untreated. The subjects enrolled in the experiments were 600 people, mainly poor peasants living in Macon County. Of these, 399 subjects had already been infected with syphilis before the start of experiments, and 201 had never been infected with syphilis. The subjects were promised free medical care as an incentive for participation in the study. USPHS never informed them of their syphilis diagnosis and provided disguised placebos and diagnostic procedures as a treatment for bad blood. And some subjects infected their wives with syphilis, and some of the subjects' children were born with congenital syphilis. About 30 people died as a direct cause of syphilis, and about 100 died from complications caused by syphilis. The USPHS told the subject that the experiment would last 6 months, but the study was extended to 40 years. After funding for treatment was lost, the experiment was continued without notifying the subject that they would never be treated. None of the infected were treated with penicillin, even though by 1947, penicillin treatment was widely known and had become the standard therapy for syphilis. In 1966, Peter Braxton, a PHS venereal disease investigator, sent a letter to the National Director of the Division of Venereal Disease expressing his concerns about the ethics and morality of the extended Tuskegee syphilis study. The Center for Disease Control Prevention, which then controlled the study, reaffirmed the need to continue the study until completion, until our subject had died and been autopsied. Buxton finally went to press in the early 1970s. The story of the Tuskegee study became front-page news in the New York Times. As a result of disclosure to the public, the CDC and USPHS appointed an ad hoc advisory panel to review the study. The panel determined that the study was medically unjustified and demanded its termination. This study is a tragic example of the history of human research that is unethical, immoral, and in history of racial discrimination in the United States. Ethical and legal issues. According to Emmanuel et al., this immoral and inhuman Tuskegee syphilis study has brought issues of racism and bioethics across the United States. The researchers conducted Tuskegee study without obtaining informed consent. In addition, subjects' research participation data and personal health information were not protected. It's a violation of privacy and confidentiality. Even though there was no law to protect human research subjects at the time, the Tuskegee studies researchers should not have deceived their study subjects with false information. The researchers should accurately have described the purpose of the study, the process, the expected risk during the study, the benefits, and the subject's rights. Even after penicillin became an effective treatment for syphilis, the experimenters in Tuskegee study did not provide the penicillin therapy to the subject. Impact. According to Shevers et al., the stereotype behind the Tuskegee study, in which 100% of its participants were poor or African American men with minimal access to health information, mirrors the racism in the United States at the time. And researchers who read the study believe that African Americans were mainly susceptible to venereal disease because of their race and thought that the subjects were not interested in receiving medical treatment. The revelation of the injustice the revelation of the injustice of the Tuskegee study have significantly caused the distrust of the Black community toward public health in the United States. In the period following World War II, the disclosure of the Holocaust and related Nazi medical abuses caused changes in international law. Western countries made the Nuremberg Code to protect human research subjects. In 1964, the Declaration of Helsinki established standards for experiments involving human beings to must obtain the informed consent of participation. Impact. Yeah. Even after the Declaration of Helsinki and the Nuremberg Code enactment, the Tuskegee studies experimenters continued to conduct the inhuman experiments without changing their research protocols to the new standards. Disclosure of Tuskegee study to public had provoked public outrage and led to the need for the bioethics and related laws. As a result, the National Research Act of 1974 was enacted. The National Research Act instituted the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research to set guidelines for human subject research and to supervise and regulate the use of human experimentation. The National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research created the Belmont Report in 1978. The Belmont Report summarized the ethical principles and guidelines for research involving human subjects. Three core principles were determined: respect for persons, beneficence, and justice. After enacting the National Research Act, researchers who want to conduct human research must submit their research protocols to the Institutional Review Board (IRB) before the investigators start any study on human subject. Also, the investigators should accurately describe the purpose of the research, expected risk, benefits, and subject rights without falsehood to study participants. According to Sharvers et al., the Tuskegee Spiller study and its results limited African American participation in medical research and their willingness to participate in disease prevention program. African American participation in medical research is also essential to resolving healthcare disparity. But yeah, however, recruiting African American subjects from current human studies is not easy. The healthcare professionals' awareness of this racial health disparity is essential to culture competence in current healthcare. Black male patients assigned to black male physicians are more likely to seek disease prevention service than black male patients who are assigned to non-black physicians. In particular, in the case of invasive medical service such as injections and blood collections, the health-seeking behavior gap between the two groups were more significant. These statistical results are more apparent in those with high distrust for healthcare or those with environmentally limited access to healthcare services. To avoid similar issues, healthcare professionals must comply with ethical and legal standards. First, human beings should be treated as autonomous beings, and those without autonomy have the right to be protected. Participation in clinical research must be voluntary, and subjects who cannot decide by themselves, such as minors, should not be forced to participate in any study. Secondly, clinicians and investigators should maximize benefits and minimize risk as much as possible. The safety and the interests of such subjects should be given top priority. No exception should be made even if the study's purpose is advancing medicine and developing therapeutics that can save many people. Also, researchers should design their protocols to ensure that the burdens and benefits derived from their research are equally distributed. Investigators should be careful to spread the burdens and benefits equal to the socially marginalized groups and the wealthy people. And informed consent is the most important concept in bioethics. Researchers must explain to the subject their study procedures, objectives, risks, anticipated benefits, and other treatment options and obtain the subject's voluntary consent. The researchers must also inform the subject that they may withdraw from the study at any time. Also, concerning the principle of beneficence, researchers should guide the risks and benefits to the subject. The benefits of participating in the study must outweigh the risks. Also, researchers should not select subjects based on personal prejudice or judgment. Researchers should not induce certain social classes, such as African Americans, socially marginalized groups, and even criminals, to participate in any study. Thank you for watching my presentation. Have a nice day.